Vaccine advisors to the CDC just postponed a vote on a potentially dramatic change to childhood vaccinations to tomorrow. So in question is the hepatitis B vaccine given to newborns. Today, advisors said they were confused about exactly what they were being asked to vote on because the wording keeps changing. The decision could affect long-standing guidance on the hepatitis B shot. So our chief health editor, Dr. Partha Nandi, joins us now. And Doc, why is the federal commission voting on this?
That's interesting, right? So since 1991, one of the advisory committee on immunization practices has recommended that every newborn get the hepatitis B vaccine within 24 hours of life. And it's been incredibly effective, to say the least. Pediatric hepatitis B infections have dropped by 99%, from 16,000 to less than 20. So what's behind this discussion, right? So a proposal earlier this year suggested delaying the dose for babies whose mothers test negative for hepatitis B. But here's the challenge. Around 12 to 18% of pregnant women in the U.S. are never tested for hepatitis B. Some test results can be missed due to false negatives or errors, and many moms who test positive don't get the recommended follow-up care. So babies can fall through the cracks. And sadly, get this, 9 out of 10 babies who catch hepatitis B become chronically infected. This means their immune system doesn't clear the virus. Hepatitis B is a serious liver infection, lead to scarring called cirrhosis, liver failure, or even liver cancer later in life. And so for infants who develop chronic hepatitis B infection, roughly 25% die earlier from this disease. That's tragic.
Yeah, so what happens if the committee votes to delay this or remove the recommendation giving newborns the shot?
Yeah, I'm worried about this, right? So if the guidance suggested, I worry that it will confuse parents and increase risk at a time when babies are most vulnerable. There's data from the Vaccine Integrity Project report that is quite sobering. It estimates that delaying the vaccine from birth until 2 months of age could lead to more than 1,400 infections, and get this, 480 deaths per year. That's too many in my opinion. Keep in mind, hepatitis B isn't only passed from mother to baby. Roughly 2.4 million people in the U.S. have hepatitis B, and nearly half don't even know they're infected. So baby could get it from a caregiver, a friend, a family member, or even a contaminated surface, because the virus can live for more than a week outside the body. That's why giving the first dose is super important. Data from 400 studies and reports over 40 years show that it's safe and it works. As a doctor and as a dad, I support the birth dose, and so does the American Academy of Pediatrics, because it saves lives. So we've got to be able to talk about this and make sure we get the right decision made to save our babies.
Yeah, and navigating it moving forward.
100%.
Yeah. All right, thanks a lot, Doc.
Of course.
Appreciate it. This week on the Dr. Nandi Show, uncover the silent killer affecting over 1 billion people, hypertension. Dr. Nandi explores the hidden dangers and reveals how to detect it. Tune in Sunday at 5 p.m.